OBGYN ASMR clinic. My name is Lee and I'll be taking your vitals back and just doing some history taking before the provider sees you for your visit. How are you today? Awesome, awesome, awesome. It looks like you're an established patient. You are here today for some full STI testing. Okay. Have you had any recent known exposures at all? Okay. Gotcha. All right. You said about a week ago? Okay. Are you experiencing any vaginal symptoms today? Abnormal discharge, odor, itch, burning? Nothing like that. Are you having any urinary symptoms today? Burning when you pee, peeing more often? Nothing like that. Okay. Any pelvic concerns today? Any pelvic pain? Like a dull achiness, a sharp stabbing pain, anything like that? No? Okay. All right. So pretty much no symptoms or concerns. Okay. Do you use any methods of birth control at all? I understand. Okay. Now, for sexually transmitted infection screening, we can collect it via urine, vaginal swabs, and or blood work. Off of the urine or swab, we can collect gonorrhea, chlamydia, and trichomonas. I tend to prefer the vaginal swab as I believe it's slightly more accurate than the urine samples. For blood work, the CDC recommends screening for things like hepatitis, HIV, and syphilis. My job is just to tell you that the only thing that is not recommended through the CDC to routinely screen for is herpes simplex. Okay, so not having any concerns for genital outbreak, or you haven't had a partner with known herpes diagnoses? Okay. All right, now are you okay with us collecting a vaginal swab versus urine sample? Okay. So yeah, it'll just be one swab for that then, since having no other symptoms. And do you mind giving me the first day of your last menstrual period? Okay. Awesome. All right. Thank you so much. And you get your periods every month. Are you taking any medications right now that we should be aware of? Okay. Any allergies to medications at all? All right. Very good. And do you know how tall you are? Okay. All right, excellent. Well, if it's okay with you, I can get started on the vital signs, and then we can move on to just kind of prepping your room for your screening today. Yeah, awesome. All righty. So, I am just going to grab my blood pressure cuff here. And then I am just going to place it on this arm over here, if that's okay. You're going to slide your arm through. There you go. Does that feel nice and snug? Okay, cool. All right, let's see. Just going to place this here. That extra air out for you. Your blood pressure is normal. You could slide your arm out. There we go. All right. Let me just place this back inside here, and then we'll get your temperature. Right. just going to do a temperature check. Alright. Let me just prep this for disinfecting after. There we go. So this is going to go right underneath the tongue, if you remember. This is going to go right underneath your tongue. Perfect. All right, temperature is normal. Let me grab this here, and then we'll throw this out. Let me just write up your vitals, and then we'll get your room ready, okay? Whoop, didn't work as what I planned. There you go. Let's get rid of that. All right. I'm gonna place this back. I am just going to sanitize one more time here. All right. So basically what we're going to do is I am going to leave you at the bottom of your bed here with a drape. You'll just get undressed from the waist down, and then let me break this. Okay. And then we will do, probably if it's okay with you, an internal pelvic exam with a speculum. So I'm just going to get that set up here. We have our STI swab that we'll collect for the gonorrhea, chlamydia, trichomonas. And then the last part is she may do an exam with her glove with some lubricant, just to note to see if you have any cervical motion tenderness, and kind of to rule out things like pelvic inflammatory disease with any tenderness in the pelvic area, okay? You're fine with all of that? Alrighty, well, I'm going to give you some privacy here, and then Leanna, the PA, will be in. Oh, and then before I forget, you're also going to get your blood work, so blood poke through the arm, and then we'll send that out for hepatitis, syphilis, and HIV. Just so you know, before I leave you here, is I would recommend repeating the screening in a few months, just because it may take some time for some of these test results to show positive, given how recent the exposure was. Yeah, no problem. Absolutely. Well, let me give you some privacy here, and then Leanna, the PA, will be in. See ya. Alrighty, so it looks like we are doing some STI screening for you today. You wanted the vaginal swab collection for gonorrhea, chlamydia, and trichomonas, as well as some blood work for hepatitis, syphilis, and HIV. Alright, sounds good. And then I'll give you more info on everything that we screened for today for you. But let me just get some gloves on. We can get the, how about we get the blood work first, and then we will end it with the vaginal testing, okay? Awesome. Do you have absolutely any questions at all before we get started? Now, before we draw your blood work, can you confirm your first and last name for me? Date of birth? Okay, those orders are correct. Do you have an arm preference, by the way? You're fine with this side? Okay, cool. Let me grab some alcohol, just to kind of clean off the area here. I knew I was forgetting something. I thought I came prepared, but all right. So we'll do this arm for you, okay? Awesome. So we are just going to clean off. You can hand me your arm there. Perfect. Just going to clean your arm here for you. Make sure it's nice and sterile. Almost done. Can never be too sterile. Okay. Now I am just going to take one of these ties here. And I'm just going to tie your arm. Let me know if you feel lightheaded at all, okay? Okay, we'll give your veins some time to sort of, there we go. Okay, just gonna collect a few different vials, okay? I'll hold on to your arm here. Okay, number 1. Doing great. Yep. Alright, let me put that back in. Apologies for the traffic outside. We're gonna get number 2 now. Pinch. There you go. Okay. We are done with our blood collections there. I am just going to take a piece of gauze. I'm gonna kind of hold it there to stop the bleeding and hopefully prevent a lot of bruising for you here. And I am just going to take a Band-Aid and put that over as well. Okay, there you go. And then let me untie this. You can relax your hand. There you go. All right. How is your arm feeling? Okay? Good. All right. Are you okay for us to move on to your pelvic exam for the other collection? Okay. Just making sure. All right. So we are going to take a speculum here. I've got my vaginal swabs here to collect. All right. The first step actually is you're just going to feel my hands on the outside. I do just want to do a quick external exam just to make sure everything looks normal. There's no signs of suspicious moles or lesions. External exam is normal. Next is the internal exam with the speculum. You're going to feel some pressure here. There we go. There's no obvious signs of infection, which is good. We're going to collect our swabs now. One more swab here. Okay. Let me just open up the specimen container. Okay. Okay. Sample is in there. I'm going to take the speculum out, and the last part of the exam is just going to be an internal one with my glove and some lubricant, okay? Okay. You let me know if you feel any pain at all. Pain? Let me get you covered back up there. I'm going to take off my gloves. You are all done with your STI screening today. So I will give you more information at checkout as far as when they recommend repeating STI screening. I will call you if there's anything that comes back not normal on any of these tests, and then we will counsel you appropriately if that's the case. With that being said, do you feel lightheaded at all? You feel okay? All right. If it works for you, I'm going to give you some privacy to get dressed. You'll have access to all of your test results through your portal, and like I said, we'll be in touch if anything is flagged. All right, well, you have a good day. I'll see ya.